Okay, so hey, welcome everybody to the Neuro Way to Practice podcast. I'm Dr. Ted Arkfeld, and we have a special guest with us tonight. We have Erica Whitmire. I have known Erica for a long time, going back to high school. I could probably name every one of her boyfriends, um, all one of them, and then the guy that she eventually married, right, Erica?
Yes. Yeah.
All right, got you on that one, didn't I? You didn't expect that one. Yeah. Okay, so Erica, the reason she's on tonight, and we're doing this a little bit differently. Normally, I would do the podcast after we're done with the treatment, but we're about the halfway mark with her. And I just think it's important that people understand that there is an option to traditional PT if you've had surgery and you want to go through the rehab process. So Erica just had surgery to repair a right labral tear in her hip about three and a half weeks ago. And she opted, instead of doing traditional PT, to come into our office and have us do the rehab on her right hip. So, Erica, I'm going to have you take it away right now. Tell us about the symptoms you were experiencing before the surgery, all the frustrations you were having, and then tell us about the surgery, and then tell us about how your rehab is going. So take it away.
All right. Well, my hip started bothering me about 5.5 years ago. Running was uncomfortable. I could get through a couple miles, but couldn't get any more. So then I stopped doing that. And then I went to physical therapy for my right hip and my right knee. And they just told me it was my IT band and I need to stretch more and work through that. So I did all the icing and all the stretching and all the resting, and then tried to run again and it didn't work. So every exercise just kept getting more difficult. And then fast forward to about a year ago, I started. Maybe
I think so, yeah.
I was saying, started hanging out with you, and adjustments were helping tremendously, but still unable to run. But I was able to do my Peloton and all those sorts of exercises virtually pain-free from what I was experiencing. And then it just got worse. So you sent me in for x-rays and an MRI, and I saw 3 different doctors at the orthopedic place until I finally got to the sports medicine doctor that I needed to see. And they needed to reconstruct my femur bone because it was shaped like a club instead of the top like a mushroom. So he did that, and he thought that was the cause of what caused my labral tear. So then I had that fixed. Today is 4 weeks from my surgery date. Exactly.
Okay.
So exactly 4 weeks from 4 weeks ago, I had it done. So, and I feel great. I don't have the daily pain that I had before surgery. I still have, recovery discomforts here and there. We talked the other day, my main discomfort that I have is just, seems like the femur bone is still healing from that being reconstructed there, but that I've been using my PRS system at night for blood flow every night for that. And it seems to help tremendously. Like I don't have the ache when I wake up in the morning. And
great. Okay, so for our listeners that are not familiar, we use a therapy called ARP therapy, ARP, Accelerated Recovery Performance. And there are 2 units. There is the home unit, which Erica just mentioned. It's the PRS unit, Personal Recovery System. And then we use the RX unit in the office. So these are neurological stimulators. And what we did before the surgery to really kind of tease out to see if it was purely a group of muscles that weren't firing properly due to some kind of breakdown, creating excessive joint wear and tear. She actually did the PRS at home and came in for a little RX therapy. And you did fine running on our treadmill in the clinic, but then you went out and started trying to run on the road, and that pounding on the pavement was really, that's when we knew we had to get the x-rays and go to the MRI and everything. It was more than just a muscle not absorbing the forces.
Yeah.
So she has the surgery by Dr. Eric Mancini over in Petoskey, and did a really, really good job. And then so Tuesday, she had the surgery. Friday, she's in the office and she starts her rehab with us. The first thing we had to do is get the swelling down. So we used a therapy called Hyvamat to get her swelling down and get that scar a little bit more pliable. And she said she's using the PRS at home. So the PRS and the RX, but the PRS at home is crucial, absolutely crucial for the success after surgery, because she can do the therapy all the time while at home. And the therapy, it consists of two things. There's pulses, 245 pulses per second, going from the pads. So it looks like a regular muscle stim pad, but it's a direct current and it's so much more powerful than it's not a TENS unit. It's not any kind of electrical stimulation that you're probably aware of, if you're aware of any. So what I told her to begin with right after the surgery, get on the blood flow. What that does, it increases the circulation in the area and brings in new blood flow, nutrients. And I think that's crucial in order to flush out all the waste products and help with getting the swelling and then bringing the new circulation in there for those tissues that need that. And then I also instructed her to use the stimulation part. Now, the stimulation part is where we can prevent atrophy or the muscle from weakening even right after the surgery. And it's not harmful to the joint because you were never weight bearing when you were doing the therapy, were you?
No.
So she did that. She actually purchased a PRS unit so that she could really jumpstart her home therapy part. And then we've been seeing her 3 times a week. And we just take her through a variety of different exercises. To begin with, you were just laying on your back and we had you do the exercises with the RX. It was totally non-weight bearing, wasn't it?
Yeah. I just a week ago was able to put weight on. My foot was cleared to do that. So.
Yeah, because you got out of the crutches and out of the brace. So
Mm-hmm.
when she first came in, she was on crutches and she had this brace that she wore. I never seen anything like it. And you're probably hoping you never see anything like it ever again. Right?
Yes. It's stored away in my basement. I hope I never have to bring that baby back out.
I do too. So that we got her doing the, very, I should say we have a protocol, but then the protocol changes based on what Erica tells us on that particular day. So in traditional PT, what would happen is they would do like a warm up period. And sometimes, like I know for knees example, they will get a patient on a bike, stationary bike, and they put them on a stationary bike for 15 minutes to warm them up. We don't have to do that because with the RX unit, we can get her going and it stimulates at 500 pulses per second. So to put that into perspective, the brain communicates with your muscles and your muscles back to the brain at 2 pulses per second. So the difference, and I believe that we get the results that nobody else gets because we look at it differently. I look at it from a neurological standpoint, is that our body is full of receptors and there's muscle receptors, muscle spindles, and all the muscles, and they weren't being stimulated, and they can't be stimulated under traditional PT. It's kind of hard. Then you got your bone, the bone that was shaved down, and like we discussed the other day, bone is very sensitive, and so that's why you're still having some of those residual bony type pain in there because your brain has to recalibrate to get used to the original parts not being there, all the parts not being there. So, do you want to tell everybody what we've been doing the last couple days that's been kind of fun and unusual, and you've been a little bit more sore?
Yeah. Well, I do have to say that you must have worked your magic by telling me that it's just going to work itself out because today was the first day that by the end of the day, I didn't have that like achy feeling in my bone. And
Were you back to work today too?
Yep. Yep. So
Tell everybody what you do so they fully appreciate.
So I'm a registered dental hygienist, but I'm on my feet all day. We never sit down in the job that I do. I work for an endodontist office, so I'm doing anesthetic and doing imaging and testing and all that all day. So we don't sit down in my job, and I'm always on the go and always moving and walking and going fast paced. So I actually was able to, the day I was supposed to be off crutches, be at work all day and virtually pain free. I mean, I was a little bit sore and achy at the end of the day, but I would say that pre surgery, at the end of the day, I was more sore pre surgery than I was post surgery at the end of my long day.
You just went back to work too. Was it last week?
Last
The
week.
first. Okay. Go
Yeah.
ahead and give a shameless plug for where you work. Go ahead.
Otsego Endodontics.
Okay.
Yeah.
So if anybody needs endodontic care,
Yeah. They're fabulous. Dr.
go,
McMahon and Dr. Brodsky, best
all
of
right,
the best.
go see Erica. Uh, at any rate, this is what I'm talking about. People would normally not associate post-surgical rehab with chiropractors, and really, Erica trusted me, and so, but that trust, I know, it's been built up over
Even
years.
after all these years, I
I
still
know she still
yeah.
did. But that because people just would not associate with that. You wouldn't go see a chiropractor for post surgical rehab. And in all honesty, probably 5 or 6 years ago, I would have told you, no, I can't do that. But then came in this technology we brought into our office, this wonderful technology that allows me to really shave off weeks off the rehab process. And I firmly believe that what we can do in a 30 minutes in there for about 30 maybe 40 minutes at the most, right?
Yep.
And what we can do in that amount of time, I think it would take probably regular PT probably a week to 2 weeks to accomplish, even if they could accomplish it in that time. I'm not even certain they could. So what's really neat is we're able to now do a assisted stretching routine on Erica before we even start doing the exercises, the strength and conditioning. So, do you want to tell everybody what that is like and what it consists of and how you feel afterwards?
Yeah, I feel great after. Pre surgery, I was just sitting on the floor stretching all the time, trying to get the aches and pains out. So that's what I miss most is I'm supposed to, limit my manipulation and bending over 90 degrees, my hip and leg over 90 degrees. So when I come in to you guys, I get the PRS put on me right away, and we just put it on to where it feels comfortable. And then we do three, increments of each
Mhm.
stretch. One where it feels like a level 3 out of 10 for me, the next where it feels 5 out of 10, and then the final 7. And so we've been stretching like my hamstrings, my quads, and my hip flexor and my glute muscles, and it's been awesome. Like that's definitely my favorite part. And we did our first step of strength yesterday
Mhm.
where we had that on, and I did sideline leg lifts. And then we stood and I did circles and kind of swung my hip forward, back, side to side. And my muscles feel awesome today. Like today
Great.
and not, I have no complaints over any day, but today is like the best I've felt even.
So what we did is we like she said we put the PRS unit on her when we start to do the stretch, and we separate the pads. We put it on the muscle that we want to focus on the stretch, and we go through the 5-3-5-7 routine. But in between each of that, we're increasing the intensity on the PRS unit, and we just started that probably about 2 weeks ago, and it's been like a major game changer with our
Hmm.
stretching routine. And so we started doing that, and then that counts as our warm up. But we also need to get her more flexible because there's scar tissue involved still that we're still trying to break down a little bit. And then this week we put her on motion guidance. Motion guidance is just a strap with a little laser beam, and that way she's visually guided on what she's doing with her leg when we ask her to do side lifts and then do the standing exercises. It's just something so you really don't get bored doing it, right? So you kind of get a feedback on what's going on.
Yeah, and I could tell that at the end, my laser lines were a little squiggly because I was getting a little sore, and that's something that typically I would be able to do without being sore. But with that, the ARP unit on and just giving me that much more of uh, intensity to the workout, it made me feel. I thought I was going to be super sore today, but I felt great today.
So last night, did you get on? Did you do the blood flow big time last night?
I just do it. I last night I just did it like I normally do. So just
Okay,
on my like side hip where the femur is, where I get that bone achiness, but that was it.
sure. Okay. So that I think that played a big part because it was able to clear out any of the garbage products from doing the workout. The thing is that we're doing, and I keep going back to a neurological base because everything is neurological. And this is again where we're different. I take a different look at things instead of a pure orthopedic standpoint and mechanical. I realize that all of our tissues all have these receptors and they got to fire up to the brain, and we have to let the brain know what's going on. And that's why we go at different angles with her exercises, and that's why the art therapy has been so valuable. um, she's doing great. What we're going to do, Erica, will you come on again on the podcast after we get you all released and tell us your final outcome on how you did?
Absolutely.
Oh, I love it. I love it. All right. Well, that does it. That's I couldn't say it any better. And again, if you know somebody that has had surgery, if you're thinking about surgery, there's two things. Let's get you in for a consultation. You can just come in and talk to me and um, see if this is a right fit. But the prehab, like she started, is crucial. You've got to get those tissues ready to even start this, to be ready for surgery. And then the post surgical rehab is huge. And so give us a call. And this is just one of many successful outcomes. And I know you're already there. If you were to say on a percentage basis, how much better are you? Are you 50%, 75%? What do you think?
Oh gosh, if I base myself off of pre-surgery, before I started even doing the pre-workouts with you, I would say that I'm like 85% better.
Nice.
Like, I just feel, and then when I was doing the ARP therapy before surgery, I was feeling better. So then, you know, I was very nervous about going into the surgery. I talked to you about like what
Hmm.
am I going to be like? Am I going to, because I've had 3 other surgeries, not on, ligaments or anything like that, but this recovery was way easier than I thought it would be, thanks to you and the
You no.
tools you gave me, because I mean, I was very nervous, but I think following the protocol from start to finish, from doing the pre stuff to having that PRS unit on me, I started the day of surgery because I was home by 10:30. I had that baby on me by at least noon and was doing the blood flow because I was just ready to feel better. I'd say the only complaint I have is that you're making me feel too good and I still have a lot of restrictions
Well, we're
un-
going to work on those restrictions.
until a month from today I get released from Dr. Mancini for my restrictions. But yeah, I feel
Good,
good.
good. So there's a common denominator, everybody, in the people that we've had the best successful outcomes, and it's been all of them. We haven't had one person have a failed surgery that we could not rehab them, get them back enjoying their activities of daily living. But they all been motivated. They've all done everything I've asked them to do, and they do it in a disciplined manner because they're motivated to get back their life. I mean, we talked about it one day, and you were saying this sucks. I mean, you're a mother too, and you're married, and this thing just totally disrupts your life, and you lose your freedom, and you are dependent on other people. And I know you're not built that way. It's not in your genetic makeup, because I know your mother and your sister and your dad, and you guys just aren't dependent on people. And quite honestly, I don't know what mother really is.
Yeah.
So this is why I love these stories, because we're helping you get back to Erica, basically.
Yeah, for sure.
So, all right. Well, give a call to the clinic. Visit us. I'm going to give a real quick. Let's see if I can do it. I've got to do a. Oh, I can't find it. I was going to give a shameless plug where it has ARP chiropractic come across. Just call the clinic, 989-448-8065. Operators are standing by.
You won't regret it. Or maybe you will.
All right. That's enough. Talk to you later.